Today I'm going to be talking about therapist red flags, what to look out for, how you know if you're with a good therapist or a bad therapist, what are the signs, and then how to break up with your therapist or what to do if your therapist breaks up with you. So yesterday on my Instagram, I asked you to send me the worst things that your therapist had said or done, and the stuff I got was mind-blowing. I was like, what the heck? So I want to read out some of the answers that I got before I go into the video so that you're able to make a better decision when looking for a therapist or in determining whether or not the therapist that you have now is a good fit for you. The first one I saw right off the bat here is I turned into their therapist. We're going to talk about that. The therapist kept cutting their words off. That's really frustrating. Telling me to cry more and then saying, I really don't know what more I can do for you. Laughed at me after a suicide attempt that ended in the hospital. Telling me I caused my own anxiety. One time I was told to stop crying while I was processing my trauma. What is wrong with these people? She said, if you don't change, you're going to lose a great man. He was not a great man. Absolutely no feedback. After an hour of just talking to myself, no feedback whatsoever. Ate their dinner during a telehealth visit. Told me to freeze my eggs at 28 because she didn't think I would get married soon. Telling them I think I have ADHD and their response was, a diagnosis doesn't matter. What in the world? There's so many of these, but I'm going to stop there because I really want to get into this video. All of these that I read off were really huge red flags, but there are more. And I realize after being on social media talking about this that a lot of you don't really realize what good versus bad is, what a red flag is. Should you stay with the therapist that you have now, or what do you do if you need to switch? So let's start with, how do you know if the therapist you currently have is actually helping you? So the first thing I want you to consider is, have you set goals? When you went in to see this therapist, did you tell them what you're wanting to work on, what things you're struggling with, and did they help you set some sort of goals to work towards? So if you have anxiety and it's impacting your relationships and your friendships and your work, what are you doing in session? What are you talking about? How are you processing the feelings so that you get to that said goal? Are they pushing you? Now, I'm not saying they need to push you too hard or force you to talk about things or feel things that you're not ready for, but a good therapist should be challenging you to sit with these uncomfortable feelings and to dig deep. They shouldn't just let you be like, well, I'm not comfortable talking about my inner child, so we're just not ever going to go there. Maybe you ease into it and you come up with a plan on how to do so, but there should be some sort of discomfort and some sort of challenge when you're in therapy. It should not feel like a walk in the park. Another thing to look out for to determine if your therapist is a good therapist is, do they have specific training in the area that you came to them for? So maybe their main focus is trauma or anxiety or depression. And that means that they are getting trainings in that area. They have really deep knowledge about those things. They're able to help you in various ways, not just one type of modality. So if something isn't working for you, they're able to shift and work in another way, but for that same issue. They need to have special training. And so when you're calling a therapist up and you're like, hey, do you have availability, is definitely ask them, what experience do you have working with other clients or other patients that have the same issues that I have? Notice that in the medical world, you have the generalist, you have your primary care physician that can check you up for basic things. But then if you're struggling with a heart issue, they're sending you to the cardiologist who has special training in cardiology. If you have lung issues, you're going to the pulmonologist that has specific training in pulmonology. It's the same thing for therapy. Yes, you have the generalist that maybe work at specific agencies or in hospitals because they're seeing people all around. But when you're coming in to work on a specific issue, you want to find a specialist in that area. That is how you know you're going to be in the best hands. So the one thing you want to ask yourself is, do you have genuine respect and do you get along with that therapist? Research continues to show us over and over and over again that the number one determinant for successful therapy is the relationship that you have with your therapist. Is it a good relationship? Do you feel safe and respected and understood and validated with that therapist? If the answer is yes, you are going to create the perfect space to be able to work through some of the really challenging things that come up. The next thing to determine if you have a healthy relationship with your therapist is how much self-disclosure is happening. So self-disclosure is not from you. You are obviously going to be disclosing a lot of things to your therapist. But for the therapist, there is a fine line. Self-disclosure from a therapist should have a purpose. And that purpose is to help you or to create some sort of intervention to help you. It should not be because they're dying to tell you that they had the same issue in the past. It should not turn into a therapy session for them because now they know that you understand them because you're coming to them with the same issue. Therapy session should be about you with some self-disclosure only when it's appropriate. Which brings me to the next point, which is boundaries. That means you and your therapist have healthy boundaries. You know when session starts, you know when session ends, you know not to ask certain questions to your therapist. And if you do, because you're curious, they have boundaries to tell you, I don't think we should talk about this. Let's make it about you. You're not texting with your therapist on off hours. You're not hanging out with your therapist. It is a therapeutic relationship. You are not crossing those boundaries. Boundaries are extremely important for your safety and for the therapist's safety. And the next one is that you feel validated and you feel understood by them. Even if because you're going to therapy thinking, I feel like my problems aren't that big. I feel like I shouldn't even be here. Like maybe I'm taking up somebody else's time. If you feel that way, that's normal. But if your therapist is doing that, that is not okay. That should be the one person that is sitting there with you saying, you have every right to be here. You have every right to feel what you're feeling. You have every right based on everything that's going on. And I'm not saying it's healthy to always feel this way and we're going to work on that so that you get to a better place. But I completely understand why you would feel that way given the circumstances you've been through. And finally, and this is a biggie, you know you have a healthy relationship with your therapist if you can give them negative feedback. You give them negative feedback and they are not defensive and angry and they don't make you feel shitty about it. If something they said or something they did hurt you, you should be able to go to them and say, hey, that didn't sit well with me. You know, last week when you said that thing, that kind of felt invalidating to me. And see, how do they respond when you do that? You have to remember that just because they're a therapist doesn't mean that they know exactly what to say all the time and exactly how to behave all the time. They are human and they will make mistakes. And some of the best therapeutic relationships will include sometimes when the therapist triggers you or hurts you or says something that didn't land well. And you have every right to go to that therapist and say, that didn't land well. How do they react? What they should be doing is like, let's talk about how you felt that way. What about what I said triggered you? How can I handle this situation better next time? I am so sorry that I caused this rupture in our relationship. How can we move forward? So how do you know it's time to change therapists or let go of the therapist that you have? Number 1, you don't feel safe or heard or understood. Number 2, you haven't seen any progress or change and it's been a while. So of course therapy takes a while and sometimes depending on your issues it might take years. But if there is zero change after like a while, like you're not noticing any improvement in any area of your life, then I would take a look at what's going on there. Sometimes people don't feel like they're getting better internally themselves, but when you talk about it with that therapist in session, they are usually keeping good notes to tell you, well, do you notice that you don't think you're getting better, but a month ago, you were not able to set a boundary with anyone. And last week, I remember you telling me that you told someone when they hurt your feelings. There are some subtle changes that maybe a therapist is picking up on that you may not. So I think it's a place for a good conversation if you don't feel like there's any progress. But if you don't feel like there's any progress and then you talk to them about it and they don't feel like there's any progress or they don't have proof that there's been any progress, I would say that that's time to terminate. Number 3, they don't have training or experience in the issues that you need help with. If you're coming to them for PTSD and then all of a sudden you discover that you might have OCD, but they're not trained in a modality that helps clients with OCD, it doesn't mean they're a bad therapist. It just might mean that now you need to find a different therapist. Number 4, the modality that they're using doesn't feel appropriate. Let's say that you have a lot of trauma from childhood and the therapist that you're seeing is using cognitive behavioral therapy, otherwise known as CBT. So in this type of therapy, the therapists really focus on your thoughts and behaviors. They don't really go into the depth and in the past. So a lot of clients report that it feels like gaslighting if they're struggling with trauma. So if the modality that they're trained in is harming you, it doesn't feel right, something feels off, it might be time to switch therapists. Let's talk about some more red flags that you should look out for in session. Number 1, a therapist that uses blame. So this is somebody that is saying, it's your fault, you feel that way, you're not trying hard enough, you should try harder, if you only did what I tell you, you would get better. They're basically putting all of the blame on your feelings on you. Number 2, a therapist that's judgmental or minimizes your feelings, like saying, well, that wasn't enough of a bad experience to cause trauma, so you're not traumatized. A therapist should understand that trauma is relative and, again, go into validating and helping you work through the feelings rather than minimizing them. Number 3, a therapist that talks too much about themselves. So somebody that is just making the therapy about them, how good they are, their problems, and now you feel like you're their therapist. Number 4, a therapist that doesn't understand that trauma is relatives and thinks it's only about the big things. So this is a therapist that understands trauma as like these major life events like car accidents and wars and sexual assaults, but doesn't recognize that things like having emotionally unavailable parents can be traumatic, or going through a relationship breakup can be traumatic, or just, growing up with an undiagnosed mental health condition like ADHD or autism can be traumatic. So they're not looking at what we call the little t traumas, the day in and day out. They're only looking at these major life events. Number 5, a therapist that is always late to session. The therapist sometimes has to eat, the therapist sometimes has to use the bathroom, and so it'll happen from time to time. But if this therapist is consistently late to session, that would demonstrate that there's an issue within the boundaries with their own clients, or they're not really respectful of your time. Number 6, a therapist that is always distracted in session. You would not believe the amount of times that I have seen people tell me that their therapist was texting in session, or was listening to music, or was eating dinner, or having a snack. I heard a client tell me that their past therapist passed out and took a nap during session. If that was not an obvious red flag, let this be your warning sign that these things are not normal. They are not okay. Your therapist should not do any of these things. This one has happened to me personally and some people I know, a therapist that forgets important details about your struggles. Yes, there's lots of information. They might forget some details from time to time. But if they're just like completely missing the point all the time, if they are always and consistently forgetting information that you're sharing with them, it could possibly point to them zoning out during session. And I would say that that's a huge red flag. So let's say that your therapist has some of these, or you are not really vibing with your therapist. How do you break up with them? Here are some tips. Number 1, first thing I want you to do is to check the rules for the practice you're going to. What are their policies? Do they require a certain type of notice so that you don't get charged? Check with them just to double check that there's nothing in place that's going to bite you in the butt. That's number 1. Then once you've determined it's easy, I just need to send a cancellation within 24 hours or 48, depending on the practice. You can send an email. You don't have to be specific. You can if you want to. You can say, you know what, it's not working out for us. I'm taking a break, or whatever you want to say is fine, but you don't need to explain yourself. So if you don't feel safe enough to do so, don't. Just say, I would like to cancel all future sessions. Thank you. Done. And if you actually do have a good relationship with your therapist, but you feel like maybe I want to try something new or a different modality, there's nothing wrong with coming into the therapist session and being like, you know what, I've loved our work together. I love what we've done here, but I do think I can benefit from this other therapy modality. And so I'm going to take a break from us. And is it ever healthy to ghost a therapist? Absolutely. There are some areas where it might be really appropriate. Number 1, if they're not emotionally safe. So if that therapist is already not listening, is minimizing your feelings, is blaming you, you're never going to feel safe to send them an email and cancel. And you're never going to feel safe to talk to them about why you're leaving. So in this case, cancel your session if you can online, or call the admin, or however the cancellation happens, and just don't reschedule. So when possible, definitely communicate with your therapist, let them know you're switching out. But again, don't feel a lot of shame or guilt if you feel like, hey, the only way I can do this is just to ghost them. And finally, my last point in this video is, how do you handle if your therapist breaks up with you? So a therapist breaking up with you isn't always a bad thing. Sometimes it's because they know that you need a different modality or someone else to help you through your challenges with different training. And that's actually them doing you a service. It's not because they don't like you or they don't want to help you, but maybe they believe with their professional opinion that you will be better served with someone else. So when that happens to you and they express it to you in that way, take it as such. Don't take offense to it. It's actually a good thing. Sometimes it is personal to them, and I don't want you to take that personal to yourself. If they say they're triggered by you, or they say that they just don't know how to help you. Therapists are human and they have triggers. And sometimes your issues are issues they're dealing with themselves. And although that's unfortunate, it doesn't make them fully bad, but hopefully they are emotionally intelligent enough and trained enough to care enough to tell you that, hey, it's not a good fit right now, but I will help you find someone that is. And hopefully they offer you referrals. So remind yourself that even though it hurts, it's probably for the best. You don't want to work with someone who can't or isn't willing to work with you or doesn't have the training to work with you anyway. So it's often not about you. And finally, sometimes it could be about you, and it could be because of practice policies. So a therapist cannot help you if you continuously cancel. If you're no-showing a lot, they have their rules. They have clients calling in that need help, and a lot of practices need to abide by those rules. You need to be consistent and you need to uphold your end of the bargain so that they can help you. And if you're consistently canceling or not showing up to session, then a therapist might cancel. It may just not be a good time for you. You may not be ready for therapy, and maybe there's a better time for you to seek therapy once things are settled. So if this happens to you, if you break up with your therapist or if they break up with you, the best thing you can do is to grieve. Again, it's that relationship that we have just like any other. It's going to be sad. It might be hurtful. Find support, and then maybe find someone to help you find another therapist that's a better fit for you. I hope you found this video helpful. Let me know in the comments below, what are some therapist horror stories you've experienced? Have you experienced any of the ones I mentioned? Are there any things that I missed that you'd like to share with us? I'll see you all in the next video.